It works because I see the
Thanks.
very professional. Okay, so we're starting the first technique on the shoulder and neck. Yeah, side lying. It brings the nice thing about it. It brings the whole shoulder into a much easier way to work on them because on the shoulder because it's just closer to you. So instead of being down to the supine prone, here you are, it's here, your level. Okay. So I'm going to show you one mobilization this way. Again, it's based on the 3 points. So 1 point is here, 2 and 3. Yeah. So his hand hanging like that. Yeah. And then with it, your body is there. You're moving the shoulder together. You see, this is a lot better than either the supine and prone because it's free to move whatever you want.
Much more movement.
You can do it rolling this way, forward, backward. Yeah, good. You can have few alternatives to that movement. You might be putting their elbow here and moving it this way. So it might be easier. However, the only thing you want to be concerned is that if you do that this way, you see what happened to his hand?
Rubbing on the towel.
Yeah, not very good, not very easy. So try to still stabilize it somehow. I think really the easiest one I find so far is really put your forearm to forearm, one hand here, the other one here, and then you can move it. Okay. Another mobilization is, as I've said, the 3 point. Forearm of forearm is like creating an X, body and hands on your shoulder. And then of course it's your movement again. Yeah? Right. Next one is a bit of a stretch upward. It's a good one. You can just put their hand this way, yeah, or you can again use this. Remember that position? Yeah, pretty similar from here. Now, the risk is if you're yanking the shoulder too backward. So just be sure if this is 180 degrees up, it goes a little bit forward. You can do also nice movement around the scapula. I'm actually now moving the scapula with an assistant of this hand. I can work on the deltoid nicely, biceps and triceps. Yeah? Good. Right. So now let's involve the same thing by doing it with oil. Do you remember the shoulder 3 points? That you can do it from the opposite side, from above and from here. So the same way, you can use your hand or your imagination with nice knuckles around, yeah, and prepare the person. You can do the 3 points, and then you can either do the mobilization as we did, or you can also add the hands doing soft tissue onto the upper trapezius. So for every set of mobilization, first you need to learn the mobilization. Then after that, you can say, hey ho, you know, while I'm here, how about doing also some soft tissue massage while I'm doing the mobilization? How is it?
Painful, right?
Okay. Let's do the second one. Remember the second one? This way. So now you can keep it and then massage when it's lax or when it's stretch. Now you can come also from above. And this way you can do a really nice stretch again, downward. Most of the stretch we need is we're going down, right? To stretch the tight muscles here. So you can do a nice stretch. You can do it with knuckles also. And try, even with a deeper work, to initiate it with your body. It's very easy when you have like effleurage, but even with a petrissage, to kneel with your body. Get the momentum with your body. Good. You can come also from forward. First, you can do wonderful scalp massage in here. Really, really nice. Yeah. Which muscle do I work now on?
Temporalis.
Temporalis is here, and from the side, occipital, frontalis. Yeah. So lots of headache. It's like a line. The whole line of kind of headache can start from here. You can massage the muscle here, the erector spinae, going up to the suboccipital area, and then work on the occipitalis here, yeah, and then on frontalis, and on really everything. Really nice to do just a deep raking here. Yeah. Nice stretch. What do you think about working in front of the throat?
Don't.
No. Why? What's in there?
Choke them.
You can choke them, the trachea.
And
What
your
else?
arteries.
Stop the arteries.
And the arteries. Where do these arteries go?
Brain.
To the brain. So from the front of the throat is a lot more delicate. So we have arteries, we have veins, we have nerves that going up and down. So we leave them really, okay? Good. But what you can do if you want is go and palpate the side of the vertebra. So this is the back of the vertebra. This is the side of the vertebra. Can you try to palpate on yourself? So go backward, and then go, and you feel the muscles on the back?
Yeah.
And then go forward to the side. And you should feel more bony area. Do you feel the bony area in here? This is where scalene muscle attached to. It goes up and down.
3 scales.
So if you, yes, the 3 scalene. So if you want to palpate it, go to the back and then feel, oh, okay, this is the bony bit. If you miss it, you're falling forward. So this is not the place. Go back again, palpate the back, the spine, the erector spinae, and then you go and suddenly you feel, okay, this is it. Right. The thing, what's important about the scalene muscle, imagine they have 3 muscles going this way, and in between them, all the nerves from the spinal cord going to the shoulder and to the whole upper limb. So sometimes you have tight in this muscle, people start to complain about pins and needles, numbness, kind of a feeling of a dead arm, yeah? You have to be careful and ask for more further, if they start having it really serious, then it might be a trapped nerve and a slip disc. So how do you know? Well, you don't. Ask maybe a doctor of permission or see that they're still fine with, and then you can work on the scalene muscle. If it comes and goes and it's minor, you can work on that and you can do a lot of good here. So, and the thing is that you're not going to feel the muscle. You're just going to feel the bone and just a mush or something above it, yeah? It doesn't feel like a proper muscle because it's very thin and long and hard to palpate those. This is actually the platysma. It's not that, yeah? So, yeah, would be really nice to work. I like also in this position to work on the erector spinae because what I do, I just put my hand on the jaw very lightly and then I have a really nice lever to work in here. in here. So again, I'm looking for a lever. I always look for support. So my hand is, my base of the wrist is on the skull. Suboccipital area, fantastic, really, really good. If you master that, it's very important. Yeah. Okay. Before it gets too comfortable,
Yeah.
Past that.
Wiki.
I know I throw a lot. So how about a quick revision?
Yes, please.
Starting from here. Starting from here, doing this technique. Start just the mobilization, and then this mobilization. After you're feeling better with it, you can do the mobilization with some soft tissue, massage into that area, even like that, pretty much as we did before. After that, you can bring the hands up, the arm up, mobilize the whole shoulder, yeah? And then come to do more the neck work. I'll help you, just if you're lost, raise your hand.
Yep.
Okay?